If your liver were in trouble right now, you probably wouldn't feel a thing. And that's exactly why so many people don't see it coming. Most people believe that when something is wrong with the liver, you'll feel pain. But that's the first lie we were all taught. The liver doesn't scream when it's in trouble. It whispers, quietly, patiently, sometimes for years. This morning, a 62-year-old man named John woke up feeling normal. No pain. No fever. No emergency. But when he looked in the mirror, something felt off. His skin looked dull. His eyes felt tired. His shoes felt tighter than usual, even though he hadn't gained weight. John doesn't drink alcohol. He eats what most people would call pretty healthy. And yet, 6 months later, his doctor told him something that stunned him. His liver had been struggling for years, silently. Here's what most people don't realize, especially after 50. By the time the liver sends obvious warning signs, damage has often been there for a long time. But the good news is this. If you learn how to recognize the early whispers, not the late alarms, the liver is one of the few organs in the body that can actually heal. And some of the warning signs don't show up where you'd expect at all. Here's something most people are never told. The liver is one of the hardest working organs in your body. Yet it's also the most patient. It filters your blood, processes everything you eat and drink, balances hormones, manages fat, and neutralizes toxins every single day. But unlike your heart or your stomach, your liver doesn't have many pain receptors. So when it's overwhelmed, when it's inflamed, when fat begins to build up inside it, you don't feel pain. You feel subtle changes. That's why so many people in their 50s, 60s, and even 70s are shocked when they're told they have liver disease. They say things like, "But I don't drink. I eat normal food. I feel fine." And that's exactly the problem. In the United States today, millions of adults have fatty liver or early liver damage. Not from alcohol, but from everyday habits that look harmless on the surface. Processed foods, hidden sugars, seed oils, long-term use of common medications, and constant snacking that never gives the liver time to rest. Over time, the liver adapts. It works harder, then slower, then less efficiently. And instead of sending one loud alarm, it sends small signals, in places you wouldn't think to connect to liver health. Your skin, your eyes, your digestion, your feet, even your nails. In the next part of this video, we're going to talk about the first group of warning signs. The quiet ones that show up in daily life. The ones most people dismiss as just aging. Because once you learn what to look for, you can't unsee them. Let's start with the signs that almost everyone ignores. Because they don't feel serious. Think about digestion for a moment. Have you ever noticed that your stool sometimes looks lighter than usual? Pale grayish, or even clay-colored? Or that it floats more than it used to? Most people brush it off. They assume it's something they ate. A bad meal. A busy week. But here's what's actually happening. Your liver produces bile, a fluid that helps break down fats and give stool its normal brown color. When the liver is stressed or fatty, bile doesn't flow properly. And digestion is often the first place that shows it. Another subtle sign shows up in the bathroom as well. Your urine. If your urine has become darker than usual, even when you're drinking enough water, it may be a sign that your liver is struggling to process waste pigments that should be cleared from the body. Again, no pain. No drama. Just quiet changes. Now let's talk about something that surprises a lot of people. Vision. Many adults over 50 assume that trouble seeing at night is just part of getting older. But if driving after sunset suddenly feels harder, if glare bothers you more, if low-light rooms feel unusually dim, your liver may be part of that story. The liver plays a key role in transporting vitamin A, a nutrient essential for night vision. When liver function declines, this process slows down. The eyes feel it long before the liver does. Then there's the skin. Dryness. Persistent itchiness. A feeling that no lotion really fixes. This isn't always about weather or aging skin. When the liver can't properly clear bile acids from the blood, they can build up beneath the skin, triggering irritation from the inside out. And here's the pattern to notice. These signs don't appear all at once. They creep in slowly. Individually, they seem harmless. But together, they form a message. In the next section, we're going to look at another group of warning signs. The ones that show up on your hands, your feet, and your skin surface. Signs you may have seen, but never connected to your liver. Now let's move to a part of the body most people look at every single day, but rarely question.
Your hands. Your feet. Your skin.
Have you ever noticed that by the end of the day, your shoes feel tighter than they used to? Not because you gained weight, but because your feet seem slightly swollen? Many people chalk this up to standing too long or poor circulation. But swelling in the lower legs and feet can be a sign that the liver isn't producing enough albumin, a protein that helps keep fluid where it belongs. When that balance is off, fluid begins to settle downward, quietly. Now look at your heels. Cracked skin that doesn't heal easily. Roughness that seems stubborn, no matter how much you moisturize. This can happen when the body runs low on certain B vitamins, nutrients the liver depends on and often diverts toward repair when it's under stress. Your skin may be the first place to pay the price. Then there are the nails. Take a moment and look at them. Do they appear unusually pale or white? Do the tips look more rounded or swollen than they used to? Decades ago, doctors noticed a striking pattern. People with advanced liver scarring often had nails that lost their healthy pink color. Not because of the nails themselves, but because the liver could no longer support normal circulation and oxygen balance. And then there are the marks that seem to come out of nowhere. Small red or purple spots. Bruises that appear after the lightest bump.
Tiny veins spreading like a web beneath the skin.
When the liver struggles to produce proteins involved in blood clotting, the skin becomes more fragile.
When hormone balance shifts,
blood vessels can become more visible. These signs don't usually hurt. They don't stop you from going about your day. That's why they're so easy to dismiss. But here's the truth. Your skin is often the billboard for what's happening deep inside your body. And when these changes start appearing together, they're not cosmetic issues. They're messages. In the next part, we'll talk about what happens when the liver can no longer keep up with its most critical job.
Processing waste and keeping the blood clean.
Because that's when the body's warnings become harder to ignore. Up to this point, the body has been compensating. It's been finding workarounds, sending subtle signals, asking for attention in quiet ways. But there comes a moment when the liver can no longer keep up with one of its most important jobs.
Keeping your blood clean.
Every day, your body breaks down old red blood cells. That process creates a yellow pigment called bilirubin. In a healthy system, the liver takes bilirubin, processes it, and safely removes it. But when the liver is overwhelmed by fat, inflammation, or scarring, bilirubin begins to build up in the bloodstream. And when that happens, the signs become harder to miss. The skin may take on a yellowish tone. The whites of the eyes lose their clarity.
Colors look duller in the mirror.
This isn't a cosmetic change. It's a signal that the liver's filtering system is under serious strain. Another thing begins to happen at the same time. Bile acids that should be flowing into digestion start circulating where they don't belong. They irritate nerve endings beneath the skin. They trigger persistent itching. Not the kind that comes and goes. The kind that lingers, especially at night. Many people describe it as restless skin.
No rash. No clear cause.
And still, the liver rarely hurts. That's why so many people reach this stage without realizing what's been building for years. But here's the most important part.
This is not the end of the story.
Because unlike many organs, the liver has an extraordinary ability to recover. If the damage hasn't gone too far. And if the right changes are made in time. In the next part, we're going to shift gears. From warning signs to possibility.
From what goes wrong
to what the body can still do right. Here's something truly remarkable about the human body. And especially about the liver. It is one of the very few organs that can regenerate itself.
Not overnight.
Not magically. But steadily, patiently, when the conditions are right. Even after years of strain, the liver can begin to repair damaged cells, reduce fat buildup,
and restore function.
If it's given the chance. And that chance doesn't start with extreme detoxes or expensive programs. It starts with reducing the daily burden. One of the biggest sources of stress on the liver today isn't alcohol. It's constant exposure to sugar and refined carbohydrates.
Sodas.
Sweetened drinks. Fruit juices that seem healthy but deliver a heavy dose of fructose. To the liver, fructose is processed in a way that closely resembles alcohol. When it arrives day after day, the liver has little time to recover. Another hidden source of trouble is the type of fat many people have been cooking with for decades. Highly refined seed oils, often found in packaged foods and restaurant meals. can promote inflammation and oxidative stress inside the liver. Shifting towards simpler, traditional fats used in moderation reduces that inflammatory load. But healing isn't just about removing what harms the liver. It's also about supporting what helps it do its job. The liver relies heavily on nutrients from vegetables, especially those that support the body's natural detox pathways.
Leafy greens.
Cruciferous vegetables. Foods that quietly boost the liver's own antioxidant systems. And just as important as what you eat
Is when you eat.
the liver does much of its repair work when digestion is at rest.
Late night eating and constant snacking leave it in a perpetual state of processing.
Never fully switching into repair mode. Even small changes in meal timing can give the liver the breathing room it needs. This isn't about perfection. It's about consistency. And the people who see the greatest improvement are often those who start with the simplest shifts.
The ones they can sustain.
In the final part of this video,
We bring everything together.
and talk about how to listen to your body going forward.
Before whispers turn into warnings.
If there's one message to take away from this video, it's this. Your body is always communicating with you. It doesn't wait for a crisis to speak. The liver, especially, is incredibly loyal. It keeps working, quietly, even when it's overloaded. Even when it's struggling. Even when it's been ignored for years.
Most people don't get a sudden warning.
They get whispers. Changes in digestion.
In skin.
In energy. In how the body feels at the end of a normal day. And the tragedy isn't that these signs appear. It's that they're so often dismissed as just getting older. Aging doesn't automatically damage the liver. But years of silent strain can. The encouraging truth is this. Many people begin to feel better, sometimes dramatically. Not because they found a miracle cure. But because they finally started paying attention. They lightened the load. They gave their liver time to rest. They made small, steady changes they could live with. And the liver responded. If you've recognized yourself in any part of this video,
Don't panic.
awareness is not fear.
It's power.
Listen to the early signals. Talk to a healthcare professional when something feels off.
And remember,
It's never about fixing everything at once. It's about stopping the damage. And giving your body a chance to heal. Because the liver doesn't ask for much. It just asks that you stop ignoring it.